Good afternoon. Welcome to today's Wisconsin Health News virtual recap of the past budget and legislative session. My name is Tim Stum. I'm the editor of Wisconsin Health News. Thanks to all of you for tuning in. We have a really great panel with us today. I am thrilled to introduce Senate President Mary Felzkowski, Lisa Hassenstab, Public Policy Manager for Disability Rights Wisconsin, Jeremy Levin, Director of Advocacy for the Rural Wisconsin Health Cooperative, Mike Pochowski, CEO of the Wisconsin Assisted Living Association, and Sean Kirkby, Senior Editor of Wisconsin Health News, who is moderating today's event. Before we get started, I want to make sure we thank our generous sponsors of the Wisconsin Health News virtual series. Healthcare leaders from across the state sign up to watch these virtual events, and they would not be possible without the generous support of our sponsors. So a huge thank you to Aurora Healthcare, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Delta Dental of Wisconsin, Emplify Health, RSM, and Quartz. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to Delta Dental, today's featured sponsor. We're really grateful for their generous support. And with that, I'm going to hand it over to Sean to lead today's discussion.
Thanks, Tim. And thanks to our panelists for joining us. Lawmakers acted quickly this month to enact the state's 25 to 27 budget. Less than 48 hours after announcing a bipartisan deal, Governor Tony Evers signed a 2-year spending plan into law. Part of the reason why the lawmakers moved so quickly was to make a policy change that will mean hundreds of millions more in federal Medicaid dollars for Wisconsin hospitals each year. They had to act before President Donald Trump signed a tax and spending law that shut down the Advocate for doing so, which happened the day after Governor Evers signed a budget. So our panel is going to take a deep dive into this whirlwind process and what it means for Wisconsinites. But before we get too far into that, I kind of wanted to level set a little bit and talk about some of the more pressing health challenges and priorities facing Wisconsin right now. So Senate President Felzkowski, what do you kind of hear from constituents? What are the top healthcare challenges facing state residents?
So access is always an issue in more of the rural parts of the state, as well as in some of the high urban areas. But I think the biggest thing right now is the cost of healthcare. Wisconsin has the 5th highest hospital costs in the nation, and it's become a real concern. The average employer-sponsored health plan is about $25,000 a year. And we are not seeing anything that has helped rein in the cost of healthcare in the state of Wisconsin while we're watching other blue states and red states actually do it. There's proposals out there, but they have not been embraced. And I think taking this hospital assessment, which we're going to talk about later, is a quick fix because it helped backfill our very high Medicaid cost to continue, which was $1.43 billion this time, which is a historic high. It's double what it has been in past years, but it doesn't address the long-term considerations. 8.7% of the population in Wisconsin right now has medical debt. It's over $390,000, and that's from the Kaiser Family Foundation. So I think we are looking at employers looking to leave the state to expand, and it's all because of the medical costs in the state. It's kind of become the silent tax for our employers and our constituents. And I think it's something that we very much have to address going forward.
Thanks, Senator. Mike, could you weigh in a little bit? What are some of the major healthcare challenges facing the state and particularly in the field of long-term care?
Sure, I completely agree with Senator Felzkowski. I think, access is always an issue, and particularly from our standpoint with long-term care and assisted living, it's really Medicaid reimbursement along with the workforce crisis. We've been talking about the workforce crisis for a number of years now. Unfortunately, it just continues to get worse versus getting better. So I think lots more can get done in terms of trying to help alleviate that crisis. But I think Medicaid reimbursement's a huge issue, and particularly with the family care program. We were very much appreciative with this current budget in terms of the continuation of funding for both the family care cost to continue or the rate setting initiative, along with the direct care workforce funding initiative. that was huge for our members, and we definitely really appreciate that to really help alleviate or avoid facilities from closing all across the state, along with providers who would probably would have had to exit the family care program altogether.
Thanks, Mike. Lisa, what do you see as the top healthcare challenges right now facing the state?
Yeah, so plus one to everything that's been said already. I think access and costs are, I don't think any of us are going to disagree with those as top issues. And just to ping off of what Mike was mentioning, I mean, I think we all know that Wisconsin, the population in Wisconsin is aging at a more significant rate than some other states. And then for a lot of people, that means acquired disabilities and increased reliance on our healthcare system to meet needs. So that's definitely something that we are looking at. And also mental health. That's another thing that Wisconsin has made great strides on. The legislature has taken really significant steps over the last, decade or so in really making sure that we're beefing up our mental health system, but we still have a long way to go to meet the needs that are out there.
Thanks, Lisa. Jeremy, what do you kind of see as the top healthcare issues facing the state? What's kind of impacting rural hospitals?
Well, I definitely agree that access and workforce are some of those big items that really hit rural healthcare the most. I think there's also, I mean, it was great to see a state budget with just the bipartisan and expedited fashion that it was able to really save the state as it approached the Medicaid cost to continue. Again, it will fund about what we had seen was underpayment in Medicaid for hospitals, and covers about half of that with that increase in the hospital assessment. And I think that then has some time horizons that you will see. So in the short run, we'll have to focus on the CMS approval. We'll focus more on that Rural Health Transformation Fund, which I'm sure we'll talk about a little bit later. We also have the federal fiscal year ending soon. So the budget that has different rural programs in it and is potentially shutting down some continued workforce efforts for rural. And then again, yeah, as we look longer term, you have, again, the workforce needs. We're having a much older workforce, and in rural, it's sort of that double hit, because as they age out of the workforce, they're coming back in as patients right to the hospital. So look forward to the rest of the conversation.
So, Jeremy, I wanted to stick with you for a few questions. One of the major initiatives that we've mentioned in the budget right now is the tripling the hospital assessment to nearly 6%, which is the federal maximum. That allows the state to draw down additional federal dollars that will head to both the Department of Health Services Medicaid program as well as hospitals. Can you talk a little bit about what this assessment means to hospitals in the state? What impact this is going to have?
Well, I mean, it definitely will help increase the Medicaid rates. As I mentioned, we'll see probably once everything goes through the formula about an additional $740 million annually, which was about half of the underpayment of about $1.6 billion that hospitals were facing in this state from loss of Medicaid services. I think what it really gets to and will help is it puts us in a much stronger position going into very uncertain time with Medicaid's future at the federal level. We know a lot of things are going to happen 2027 and afterwards. And I think there's a lot to be determined and to see how that will impact Wisconsin, but we're on a stronger footing.
And when it comes to this assessment moving forward, the governor's staff has told me they did everything that they needed to do to submit this in a timely fashion before this reconciliation bill kind of froze these provider taxes. What are the next steps going forward with this? Is there any concern that it won't be implemented in the way because of these changes at the federal level, or are we kind of in the clear?
Always cautiously optimistic. So I think you never know how everything works out when you get into governmental systems, but they feel that they crossed the T's, dotted the I's that they needed to. And it is something that still awaits approval, but cautiously optimistic.
Got it. When would this funding kind of hit into the state?
Well, that again, it doesn't need to be approved, but in the budget, it has a start date of July 1 of 2025. So it will get backdated to that date.
Got it. Thank you, Jeremy. Senator Felzkowski, I wanted to switch to you for a few questions. You voted against the state budget, and when you did so, you criticized this hospital assessment change. Can you talk a little bit about what your concerns are about it? Why did you have some, why were there some issues from your perspective about this tweak?
So I think Wisconsin Hospital Association has done a really good job, as others, leading us to believe that our rural hospitals and a lot of our hospitals are going broke or are losing money. And I had one of my staff members download over 500 990s. 990s are a federal, like a tax form that is filed that shows income, expenses, and net income. And what we are seeing off of these 990s is not correlating to what the Wisconsin Hospital Association and others are telling us. I will give you an example. If I look at a hospital, I'll use Door County Medical. They have in the last 4 years ranked from a 4.2% net income all the way up to, let's see here, we've seen double digit. Like in 2021, they had 13%. Now I know 13% might be because of the additional COVID dollars coming in. But when you correlate that to for-profit businesses, whether it's retail, construction, and manufacturing, those for-profit businesses average a net income of around 4 to 5% on average. So our hospitals, who are nonprofits, not paying taxes and not paying income taxes as well as property taxes, are getting the same net income as our for-profit businesses. The other thing is, in order to draw down these additional dollars, the hospitals are paying in an additional $981 million for a total of $1.5 billion. Where does that $900 million come from? It comes from payers and ratepayers. So in the long run, we're actually driving up the cost of healthcare again to draw down additional taxpayer dollars. And my largest reason for voting no is there was not one reform in that budget, not one, to actually help those employers and my constituents deal with the high cost of healthcare that we're seeing in this state. And I just think it's wrong. We are balancing our Medicaid budget, which was $1.43 billion cost to continue, and that means changing nothing. We are balancing it on the back of the constituents of this state with their high healthcare costs, as well as employers. And we have shown over the years, there's numerous nonpartisan think tanks out there, when they look at assessments are a quick fix. We now backfilled our Medicaid budget in the short term, but it just contributes and it grows if you don't actually deal with the problems that we're seeing. And we are not doing that as a state. And I just can't sit by. I mean, I had the hospitals at the negotiating table to look at some of those reforms. And then Governor Evers basically said, if the hospitals don't like it, I'll veto it. So here we are. A $1.1 billion annual net gain to the hospital associations and to hospitals around our state. And yet our constituents got zero on it to help control the cost of healthcare. And it's unsustainable. We have to deal with this. Our Medicaid budget is there to help, as we heard earlier from Mike and Lisa, our most vulnerable people in this state. And we're not doing that. We're not preserving it for them. And that's why I was a hard no on it.
So, Senator, could you talk a little bit about what you would like to see in terms of reforms? What reforms were kind of on the table that didn't make it into the budget from your perspective?
So the number one is an all payers claim database. That's the number one reform that needs to be done so that everybody's participating in that. And our Medicaid, our DHS is one of the largest utilizers of it. That was killed by the Hospital Association over the last 2-3 budgets. In addition to that, healthcare price transparency. President Trump put it into force before he let off this last time. The problem is there's no teeth in the legislation and there is no enforcement from CMS. So we have seen about 9 states around the country now pass their own vision of a hospital price transparency, from very blue state Colorado to red state Texas and a lot of states in between, so that employers and constituents know the cost of their health care before they purchase it. I mean, what else do you buy that you don't know the cost of? It's unheard of to me that we've allowed this for so many years. And why is the hospital association and the hospitals around the state spending thousands, hundreds of thousands of dollars to kill hospital price transparency? All we're asking them to do is post their prices out there, machine readable form, so employers can utilize them, as well as an estimator on there. So if I want to go and get a colonoscopy, I can check prices with my insurance as well as the cash price before I purchase that. It would put competition back into healthcare, something that we've totally allowed to be removed. And somehow the hospital association, as well as our hospitals, are fighting it and have been allowed to kill it. In addition to that, we're seeing PBM reform at a soft PBM reform at the federal level, but we're watching other states just knock it out of the park on PBM reform, and we're not doing any of that in this state. And here was a very large opportunity to negotiate. Hospitals, you're going to get 1.1 billion annually. Let's give our constituents some ability to help rein in their costs. The largest thing that we're seeing, and this is what scares me, Sean, is when I talk to constituents around the state, they're not going to the doctor, and they're prolonging going to the doctor. And it's not because they're afraid of the diagnosis, they're afraid of medical debt and medical bankruptcy. In addition to that, a lot of our self-employed people are on extremely high deductible plans. And when they finally do go to the doctor, now they have a more acute situation, which also drives up the cost of healthcare, and it lowers the results for constituents. So simple things that we could do in this state. Other states are knocking it out of the park around the country, and Wisconsin failed greatly on this through this budget process.
Thanks, Senator. Just as a follow-up question, you mentioned the all payers claims database.
Mhm.
I mean, Wisconsin does have, I believe, a voluntary one through WHEO. I believe it's
Correct.
voluntary. How would your proposal differ from that? Would folks be required to submit claims to WHEO, or would it be a separate database?
So I wanted to make WHEO, because WHEO was created by the legislature statutorily. And it's interesting, Speaker Robin Voss was #2 on the bill. So he realized back in the day how important it was to have this. So if you are a member of ETF, so if you're offering healthcare through the state healthcare plans, then you automatically have to be a member of it. Other than that, it's voluntary. I wanted to make it mandatory so that all providers would have to be a part of WHEO.
Thanks, Senator.
And we would also put funding in there to create the dashboard for it.
Got it. Thank you, Senator. Jeremy, would you like to respond to some of the hospital assessment remarks that Senator Felzkowski made, as well as the need for reform in this area?
Well, I mean, I do appreciate her citing Door County Medical Center. It's a great facility, great hospital, the only one in Door County. So if it wasn't there, those constituents and those residents would have to travel at least a good hour extra down to Green Bay. So Door County, which is a nonprofit, and all of the 40 rural Wisconsin health cooperative members are all nonprofit. So that means that when we talk about 990s, any sort of net revenue is going back into the organization. Hospitals have 60+% labor costs. So we've seen obviously difficulty with workforce, and you also have inflationary times. So that drives up those costs as well. So they're pushing money back into the community. Door County specifically has worked on ways to get their residents and communities more childcare, more dental services, reduced pharmaceuticals. So Door County is a great organization and really is something that's very strong in Wisconsin rural healthcare. I would agree with the senator that we should look at some PBM reform. I think Pharmaceuticals and the cost of pharmaceuticals are concerning and a problem that we deal with healthcare. When it comes to transparency, we have it on the federal level. And I went to many of my members' websites, and everywhere on their website, there is a link that says price transparency. Much of them do their own price estimator tools or will utilize the price finder checkpoint that the Wisconsin Hospital Association has now had up for over a decade. So the tools are out there. I agree, sometimes it's very convoluted because, again, there are people who are insured, so they don't know what their insurance will cover. And some things that we need to look at too going forward is we are having problems with insurance companies increasing their denials. And that is, I know, very frustrating for a lot of residents and patients. And that's something that adds to that medical debt, is when something that they thought should be covered isn't, or they're told certain providers at a hospital are in network, but then some aren't. It's confusing, it's complex, and somewhere where we could look for improvement.
So, Jeremy, sticking with you for a few questions, can you talk a little bit about what this budget means for rural hospitals? There's some funding that was put aside for workforce initiatives in it. Are you happy to see that? Would you have liked to see more?
Well, I mean, obviously, again, as I mentioned first, is we are having a workforce challenges and crisis. It is both in the clinical areas across the spectrum and non-clinical. I mean, Wisconsin hospitals do, again, employ a lot of folks, and it's important to try and maintain coverage, to maintain services and access. So I think a lot is also, as I said, tied up in our federal budget. We're seeing with the federal budget coming up that there was an attempt to end the Wisconsin Office of Rural Health, so state offices of rural health, the AHEC program, which is blanking health education centers around the state. There's about 7 or 8 different regions that really help get kids interested, focusing middle school and above to get kids interested in healthcare careers. Even Wisconsin hospitals have skin in the game, and we've seen this from the Wisconsin Hospital Association. I know right now they have the More Than Healthcare campaign. They've had So Many Options campaign. I mean, we're trying to get healthcare to really be it's a good occupation. There's a lot of need beyond just clinical, and it's something that we definitely continue to focus on.
Thanks, Jeremy. Senator Felzkowski, would you like to weigh in?
Yeah, I don't want to go back and forth too much on this, but I just want to point out, it's a little contradictory to what Jeremy had said, but nonpartisan patient rights advocacy did a study of our hospitals in the state of Wisconsin as far as compliance with transparency, and only 30% are in full compliance. So we still have a long way to go on that. And the legislation that we have in the state that the hospitals couldn't accept, as long as a hospital is working towards transparency, there is no fines. It's just making sure that they're working towards it and getting there and not ignoring the transparency for the constituents.
Thanks, Senator. Jeremy, I saw you have your hand raised, and then
I don't necessarily want to back and forth either on transparency, but there are other third-party groups that rank Wisconsin as being the most transparent. And the fact that we haven't had CMS impose any civil monetary penalties, I think Wisconsin's done pretty well.
So I would add to that, Jeremy, just remember, is Turquoise came out and rescinded that, and then CMS came out with a statement that they do not have the ability to enforce. So there's a little bit more to that.
Thanks. I think one of the things that's also affecting hospitals in the state that I was hoping that Jeremy could maybe weigh in a little bit on is these closures in Western Wisconsin with Hospital Sisters Health System last year. And there are some provisions in the budget that are aimed at trying to meet the gap in care that caused. Jeremy, could you talk a little bit about those provisions? Do you see more action needed to support the meeting those gaps in Western Wisconsin?
Sure. I mean, 2024 was definitely a rude awakening. I work a lot nationally too with the National Rural Health Association. And so we've been seeing, I think last was about 150 hospitals or more have closed since 2010. So it was something that a lot of other states were experiencing. So to have Wisconsin all of a sudden have two close, and really because they were having a disproportionate share of that community's public payer, so Medicaid, Medicare. So it's something that obviously I think seeing the higher assessment, which again is Wisconsin hospital dollars getting used along with other tax dollars to go into our federal match percentage. It's something that will hopefully strengthen healthcare throughout the state because of those areas that have to that take on higher governmental payer. But I think yes, we've seen some more dollars to try and really backfill what was happening for substance use and other mental health dollars. We've seen private, both a cooperative and a health system look to expand back into that community. We've seen the health systems that are in the Chippewa Valley region expand their services. One of our members that is close, Western Wisconsin Health, has seen, in Baldwin, has seen their birthing center just grow immensely. So it's something that is needed, and the services are needed, and hopefully both the community and nonprofit hospitals can work together to get those services that are needed.
Thanks, Jeremy. Mike, I'd like to bring you in to talk a little bit about the long-term care aspects of the budget. And one of the ones you've already mentioned is this fee schedule for home and community-based services being continued. Can you talk a little bit about this schedule? Why has it been important to your members?
Yeah, it's been a, a, a lifeline for our members, particularly because what it does now, it sets at least a minimum floor in terms of what the reimbursement rates should be to providers. So in the past, it's always just been strict negotiation with the managed care organizations in terms of what that reimbursement should be. When this fee schedule or minimum fee schedule was put into place, it really kind of set that floor. So now providers know exactly at least what their reimbursement should be going forward. Along with that, prior to the fee schedule going into place, the wage assumptions for caregivers in the family care program was $13.02 per hour, which we all know that hasn't been that amount for years. And so with this new program, that's now been bumped up to $15.75 per hour, which is great. We really appreciate that. It's definitely still not where it needs to be at, whereas we're seeing right now across the state, probably caregiver wages are anywhere from $17 to $20 per hour. But again, going up from $13.02 to $15.75 per hour has been huge for our members. As we see just the cost of goods going up, inflation, wages increase, everything else. So having this continuation of funding into the program has been huge for our members.
So, Mike, just to clarify, maybe for my own sake here, this was a funding in the cost to continue of Medicaid, basically. So this was already in place. There isn't necessarily an increase in wages for folks through this. By continuing the home and community-based fee schedule, you kind of guarantee that there wouldn't be a cut in services. Is that correct?
Exactly. So what happened prior to this current budget and in the midst of the previous budget, ARPA funding was used to utilize this program. And so then with that, then because it was ARPA funding for the program, it was now that in the current budget, it was state funding utilized to continue what is currently has been used for that program.
So what would you like to see in terms of going forward and investment into how to increase these wages further? I mean, we've heard a little bit about the pressures that are facing the Medicaid budget, that this was a pretty high cost to continue, a record cost to continue. How would you like to see lawmakers move forward in the future in terms of supporting this?
Yeah, we have great conversations with all legislators, particularly Senator Felzkowski has been a huge champion for our industry and for programs such as this, and we definitely really appreciate that. I think our biggest thing is our hope is and our goal is that, going forward, could there be some inflationary increase within this program? That being that, every 2 years when the budget's going through its process, can we continue to see increases every 2 years into the program? So hopefully at some point, right now we're at that $15.75 per hour average wage. At some point, can we get up to where it is somewhere between $17 and $20 per hour, reflecting exactly what the current economic realities are?
One of the provisions in this budget that also moved forward was a continuation of the WIS Caregiver Careers program. Can you talk a little bit about this program? What impact has it had?
Sure, like what Jeremy was talking about, we're all trying to figure out ways to get other individuals working into this profession. And so, the same thing with Jeremy, we're looking at talking with middle schools and high schools and trying to figure out, can we recruit them at a very young age to get them very excited about the healthcare and the long-term care profession. And so that program has been huge because it just allows for employers, healthcare employers, long-term care employers to take other opportunities to try and recruit individuals into these programs and also give them financial incentives to do so. So along with your question, Sean, too, is the direct care workforce funding initiative. That's been huge as well for providers because what it does is it provides funding directly from the state through the MCOs to providers and then directly to caregivers in the form of wage increases and bonuses to allow them to incentivize them to continue working in this program. We're all seeing the competition with retail and industrial manufacturing and whatnot. And so we have a very hard time competing with those industries because they can increase the price of their goods to offset the price of increase in wages. Unfortunately, we can't do that because the Medicaid budget is approved every 2 years. And so as those wages increases, programs such as that are huge to allow us to try and recruit and retain caregivers and also other professions into the long-term care industry.
Were there other parts of the budget that kind of support long-term care here, Mike? Anything else you're excited to see or anything that you felt was left behind?
Honestly, we felt like we got everything that we asked for, so we were very much appreciative. It was really the cost to continue for the minimum fee schedule and the direct care workforce funding initiative. Those were our big two asks, and we were unbelievably excited that we were able to get both of those.
Thanks, Mike. Lisa, haven't forgotten about you. Would like to get your kind of input on how this budget process has impacted those with disabilities. There's some substantial increases for school aid for students with disabilities, but what is kind of your assessment of the budget?
Yeah, I think we were really happy to see the cost to continue for Medicaid. Also, recognizing that it's a significant amount of money and that we are continuing to support all of the Medicaid programs that we currently have in place. That's especially important given the federal legislation that just passed to make sure that we are in a good position for changes that are coming down the pike. Minimum fee schedule and the direct care workforce initiatives, again, were things that we were really happy to see. One thing that I just wanted to mention, again, to kind of ping off what Mike was saying, is that we really see these as it's an investment now, but it's really a savings down the road, because if we are making sure that folks are getting the care that they need and are able to do that in the setting of their choosing, which often is in a home and community-based setting or a non-institutional setting, that costs a lot less. It costs the state a lot less. It costs the government a lot less, and it costs consumers a lot less. So it's tough to see that sometimes when you're putting up the money now to support those things, but really it's a good thing for us. Again, as we see our population continue to grow in terms of folks that are aging. I think, we would have loved to have seen additional investment in mental health. We saw a little bit of an increase in or kind of a cost to continue-ish in school-based mental health services. That's an area where we really would have loved to seen additional resources go into. But I think I think there were definitely some good wins. There were some rate increases in terms of home health care and substance use disorder programs that are going to be really helpful for folks. One of the challenges that we really see too in terms of long-term care is coming with children's long-term care, children's long-term support program. It is really challenging to find providers in a lot of areas of the states, and a lot of that comes back to reimbursement rates. So that's something where we see services are really uneven across the state in terms of kids and families that are trying to access those long-term care programs for children before they turn age 18. And so it's tricky, but we would have loved to have seen some increased investment there as well.
Could you talk a little bit? One of the significant features of this deal was a substantial increase in school aid for students with disabilities, and I don't think it reached the level that you all were requesting. But what is the significance of this increase? What else would you like to see?
Yeah, it's good to see any increase, right? At the point where we were in discussions around what we'd like to see in the budget, or going into this budget, Wisconsin was the second lowest in the country in terms of reimbursement rate for special education funding, which is not great in a lot of different ways. So this moves us further in the right direction. We would have loved to have seen the 60%, which was requested by the governor. What DRW actually would love to see is a 90% reimbursement rate. But again, we understand that that's really tricky in terms of the amount of money that's available, but that's really where the need is at. So we're going the right direction. I think in terms of what this means is that we get a lot of calls on at DRW, at Disability Rights Wisconsin, from families, from educators, from others. Schools are really struggling to meet the needs of the kids that are there, and especially when it comes to kids with disabilities. And so that ends up manifesting in things like mental health issues, um, and attendance issues and disruption issues and challenges for the teachers, right? So like it's a really complex system. So making sure that we're investing the dollars so that our educators really feel supported, that kids are accessing the mental health services that they need in schools, because that's the easiest way to get kids those types of services because they're there already. So not quite where we would have liked to seen it go. We understand the financial challenges around getting us to that point, but there's still a long ways to go for us to catch up to where some of the other states are.
So there were some investments that were made in mental health in this budget. And Lisa, you mentioned you'd like to see further ones in terms of student mental health. Can you can you assess the budget for mental health? What were you happy to see in the spending plan? What would you like to see more?
I think there's some areas where the burden of funding really is falling on the counties when we might want to be thinking about having the state take that up. So the CSP program is one of those things where counties are picking up the state share of the Medicaid costs for that, and that means that they're not able to spend money on other things that they would be able to do that. It's a really important program. It's a really impactful program. So would have loved to have seen the budget take up having the state put in the state share of funding for that particular program. Again, I mentioned some of the increases in some of the services that are provided for substance use disorder, which is great. Um, I think the school mental health was funding was far lower than what we would have liked to have seen. That's an investment that, again, I think is something that will have great payoff in the future, and is something that we really need to kind of step up our investment on as a state in coming budgets. I think the cost to continue for Medicaid is huge when it comes to mental health. That Medicaid is the #1 payer of mental health services in Wisconsin and across the country. So that helps ensure that folks that are accessing mental health services through our Medicaid programs will hopefully be able to continue to do that. Again, we have some worry about what the changes coming down the pike due to the federal legislation might have in terms of people be able to access mental health services through Medicaid in the future.
Thanks, Lisa. Senator Felzkowski, wanted to circle back with you. Even though you voted against the budget, I believe there are policies in here that you support. And I know you've been a champion for years for dental care.
Oh.
There's some funding in here for increased special needs dentistry, Medicaid rates, investments to boost access to dental care in low-income areas. What parts of the budget do you think hit the mark here?
I think that budget hit the mark on a lot of things, and that's why it was a really tough vote to vote against it. I think we invested where we needed to invest. I would love to see us to be able to do more, and I agree 100% with Mike on the minimum fee schedule. $15.75 still is not enough. I mean, I get that. Even on school-based, with the special needs, for every 1% we increase that's $18 million a year across our state, which doesn't sound like a lot. So if you increase special ed funding by 10%, now you're talking 180 million annually, that's 360 million. Our new revenue for this biennium was 1.3 billion, which sounds like a lot of money until you start looking at all the different needs out there. And that is a very healthy growth pre-pandemic. That's always been about where we're at. It's even a little bit higher. But around dental care, I mean, we put 430,000 into increase for Marquette. They do a real good job on the dental services to underserved, grants to dental clinics for low-income patients. And then the one thing that we did do that I'm very happy about is sedation dentistry. We have a lot of our special needs patients that have to be sedated in order to, receive dental care. And we put 225 million all funds into that. So there is a lot of good things that were happening in this budget. But it wasn't, I just couldn't get past that one issue. Special needs dentistry is something that we're going to have to address again. I mean, I just had a constituent call me, very serious issue with a young child, but there's 1,000-person waiting at Children's Hospital for dentistry. And who do you bump to get this child in? We need another outlet for special needs dentistry in this state. And it's one of the things that I want to work on here in the future. I was just with a Wisconsin Dental Association as they had their free clinic in Wausau, which I went down and toured. It was absolutely amazing what they do there. But that's one free clinic doesn't address a lot of the needs. So we've moved the needle on some things, but we still have we have a lot more to do.
One part of the proposal that I'm sure you're familiar with in terms of your work in the insurance industry, but there is an increase to the state's reinsurance program, which helps lower the cost of individual health insurance for people buying in the state. This kind of comes at the same time that the future of more generous ACA subsidies that are available at the federal level is in jeopardy. Those are set to expire at the end of the year. Was this increase in the budget meant to kind of help address that issue? And do you see a need for additional state investment in the reinsurance program if these subsidies go away?
Possibly. So back under Governor Walker, we had the issue, and I'll never forget this, where there was states or counties in our state where there was no private health care available. And Shawano County was one of the examples, which I touched part of Shawano County. So we did the reinsurance program to help offset that. So there was actually adequate coverage around the state. As the federal subsidies come down on the ACA, there's a couple things that can happen. I mean, we can look at the whole ACA program overall. It's a very, very generous program with a lot of mandated coverage. And that's one of the reasons that the cost is so high. And then as a state, we're going to have to continue looking at that. But I'm just going to go back to the #1 way to decrease your insurance costs is to decrease your medical costs. So they kind of go hand in hand. And I think that's something that the state very genuinely needs to take a look at.
Also touching on another federal issue, this tax and spending bill that was enacted by President Donald Trump in early July, that means some major changes for Medicaid.
Yes.
And some of those changes won't take effect for a few years.
Mhm.
Do you see the legislature need to take further action in the coming months due to that proposal? Why or why not?
So the Fiscal Bureau put out a really good memo, which I've read repeatedly, on the changes to Medicaid. And as you had said, some of them aren't going to take place until January 1 of 2027. But there's also, it's hard to react to that until we see the actual guidance coming down and how those changes are actually going to affect our state. Will there be cuts? I think there will be cuts, and those cuts are, from what my understanding is right now, is they're going to be at people that are not citizens of the United States, preserving it for those that are. So as we move forward and we get more guidance from the federal government, yes, legislators are going to have to take a real hard look at what that guidance is and how it's going to affect our Medicaid program, and then make some decisions based on that. Earlier this year, I was at the National Coalition of Insurance Legislators Conference, and I had the opportunity to sit down with Secretary Kennedy. And I think that the federal government, probably not this year, I don't even know if it will be in this biennium, but I think they're also still looking at block grants to states around Medicaid. And if that happens, then each state will have to make the decision on how we're going to use that money, if we're going to add to it, if we're going to subtract to it, and then what coverages will be able to be provided under that. That's going to put it right back on the states to design their Medicaid plans, and that's going to be a heavy lift.
Thanks, Senator. Lisa, you co-facilitated the Wisconsin Medicaid Coalition, which has been spreading a lot of information about this law and how it is impacting folks in the state, how it will impact folks in the state. Do you see a need for action by state legislators in the coming months?
I inhaled wrong there. I think there will need to be, some of the provisions don't go into effect until, excuse me, until January 1st of 2027 that are likely to have an increased cost for Wisconsin. But so just to use, prove your working requirements, a lot of folks call them working requirements. We think a more accurate way to talk about them is prove your working or exempt requirements. The date that those go into effect is January 1st of 2027 unless the state gets an extension. But we will need to have a system up and running at the point that that goes into place. So right now it's estimated that we're not likely to see kind of concrete direction from CMS at the federal level on what that is going to need to look like until June of next year. But then that is only going to give us about 6 months to get a system up and running. And we don't have a comparable system for that right now. So that's something that, we might be able to borrow from other systems that DHS already has in place. But they're going to need to stand up a system to have going on January 1st of 2027. So that cost is estimated to run into the millions of dollars just to get it up and running. And then in order to maintain that system, that program, it's going to be an additional cost to make sure that we have folks across the state that are supporting that program. So that's all within the context of the next 2-year biennium that we have. So at some point, there's going to need to be a decision made by the legislature about where that money is going to come from to stand up programs like that. Again, unless we get an extension, but at some point, as long as there's not a repeal of any of these things at the federal level, those are going to be costs that Wisconsin's going to have to figure out how to cover.
So, Lisa, I think there's some confusion out there about how these requirements are going to impact people. Like, what populations in this state will be affected by these work requirements?
So there's a lot of complexity in terms of Medicaid generally, and then what was included in the bill. And so for Wisconsin, we're an interesting state because we did not fully expand Medicaid. So there's some provisions that won't impact us. We have done some expansion in terms of childless adults, and so that's a population that will be impacted by some of the provisions in the bill. So when we're talking about the prove your working requirement, that's something where we have a couple of additional populations that are going to be wrapped into that, which includes childless adults. So that's about 63,000 who would be 63,000 individuals currently participating in Medicaid that would be subject to that provision. And then there's other pieces of it. So there's a lot of changes to the SNAP or food share program as well that would have kind of additional requirements for certain populations that would require folks to participate in those prove your working requirements as well.
Thanks,
So the big one for Medicaid is really that childless adult population. And just want to point out that there's a lot of reasons that those folks might not be working. It could be that they have a chronic condition that keeps them from working consistently. They may not have a diagnosis of a disability that meets the federal definition of disability, but would keep them from working full time. They might have, children, they might be caregivers, and there's not a lot of clarity in the federal legislation about who would really be exempt. I think, again, that's going to be something that we'll continue to get guidance from CMS on what those definitions are and what that means. But until we have that, it's going to be really hard to tell what the direct impact on Wisconsin and Wisconsinites is going to be over time.
Thanks, Lisa. Mike, any action you expect to see from legislators because of this bill?
Yeah, I would just probably add to what everyone else is really talking about. We're not seeing any, at least direct cuts to Medicaid for assisted living with the federal budget, but we're waiting to kind of hear what the guidance tells us. And we're also working very closely with the Division of Medicaid Services to kind of figure out, would there be any cuts? So even if there's no direct cuts, could there be some trickle down effect from the overall cuts into our programs? That's where we're keeping a close eye on, but we just don't know until there's more guidance that comes out.
Thanks, Mike. And Jeremy, do you see any action you'd like to see from the state? You mentioned before a little bit about this rural hospital fund that you want to see details from at the federal level.
Yeah, I mean, we're also working with the Division of Medical Services and also DHS to try and really plan that out. I mean, we're supposed to apply before the end of the year. It's $50 billion, half that's supposed to be proportionally or equally distributed to the states that have their plan approved. So that also, there's several hurdles that have to be jumped through then before we also sort of see the formula that CMS comes out with. I think I know it sort of got thrown in at the end, it got increased at the end, but still probably covers, that $50 billion. It's estimated that rural healthcare across the country will see about $155 billion cut. So it only really gets about a third of the cuts that we expect to see over that 10 years.
Thanks, Jeremy. Lisa, please.
Yeah, I just wanted to take just a minute to pull back up to kind of big picture on the federal bill specifically as it relates to Medicaid. I mentioned there's not a lot of clarity in terms of kind of exemptions or things like that for a lot of provisions of the bill. There are a few that do have them. Senator Felzkowski mentioned folks who are non-citizens, so there's a little more clarity on kind of the intention around that. A lot of the decisions are going to be in the hands of our state legislators in terms of what these changes are going to look like in our state. So what we've been talking about with the Wisconsin Medicaid Coalition is that kind of boils down to 4 choices as we start to see these changes rolling in and the increased costs for things like work requirements and things like that. So the money has to come from somewhere. So either we are looking at spending more GPR in order to support these programs, or we're looking at cuts in either services that are provided through our Medicaid program, the amount that we pay to providers, or the different populations that we currently serve through Medicaid. So like that's kind of the constellation, a very small constellation of choices that we're going to have as a state. And again, these things are going to be spread out. We have a lot is still to remain to be seen in terms of what the nuts and bolts, what the details are going to look like. But those are the really big picture choices that our state legislators are going to have, and they're going to be really, really tricky. So I just wanted to state that. And then the other thing is the panel that you had a few weeks ago when we were talking specifically about this, a couple of panelists mentioned that this is all in context of our healthcare system being an ecosystem. And I just think that's something that we really need to, that folks really need to keep in mind. DHS estimates that about 275,000 Wisconsinites are going to lose coverage under either the ACA or Medicaid, and those folks have to go somewhere. So it's either uncompensated care, or they're paying out of pocket for increasingly expensive health insurance, or, but none of those things means costs are going to go down for those folks. So, and then that impacts everybody within our healthcare system, which is all of us. So sorry to be Debbie Downer on a couple of these things, not meaning to close things out on a down note, but we're going to be facing some really challenging times. I'm going to have some really important decisions to be making as a state about where our values are at, and how we choose to support people over time.
Thanks, Lisa. I had kind of one sort of wrap-up question I'm going to go through with all the panelists, and that's just, the legislature will be back in session this fall. The budget is a big part of the work that they do, but there's a lot of other issues that they take up. And Lisa, maybe we can start off with you. I mean, what would you like to see lawmakers take up this fall?
I think being proactive as possible about addressing some of the challenges that we think might be coming down the pike as a result of the federal legislation. Again, it's going to be really difficult to know what some of those things are, but I think there needs to be conversation about, one, what the program currently is. I think, as I mentioned earlier, Medicaid is an incredibly complex program. And we have a lot of new legislators that are still getting to really know what the program looks like. We have a lot of people across the state, including people who participate in Medicaid, who don't really know what the program is. So I think taking some time to get to know the program as it is before we are deciding on what changes we're going to make to it is something that's going to be really critical. But I think anything that the legislature can do to partner with DHS and kind of figuring out, where the gaps are going to be, where the needs are going to be, how we're going to make sure that as many people are going to be maintained, their health insurance is going to be maintained through the program as possible, is going to be really critical for us to be in a good position as a state and moving forward into the next few years.
Thanks, Lisa. Mike, what would you like to see lawmakers take up this fall?
Yeah, so going off of the line of consumer transparency, our big push this session is Assembly Bill 255 and Senate Bill 262. That has to do with consumer transparency for what's called referral agencies. So we're really making sure that we know that, for our elderly population, they are fully aware of what the fees are for contracting or working with those organizations, where those fees are going, who's paying those fees. And one of the biggest things too is just how long are these agencies maintaining the information of these frail elderly individuals and their families. So that's our big push for this current session, which is Assembly Bill 255 and Senate Bill 262.
Thanks, Mike. Jeremy, what are you all focusing on this fall?
It's unfortunately going to be much more on the federal level, and a lot of the sort of follow through from the One Big Beautiful Bill. So, I mean, those are efforts that will take definitely the administration and the healthcare working together. Anything to obviously help with workforce needs as we continue to age is very important. There was also some policy that was removed from the governor's budget that dealt with some enhanced insurance regulation that I think could also be something that should at least be revisited.
And when you talk about that, are you talking about the prior authorization changes?
Yeah, prior auth. I mean, that's really been something that a lot of members have struggled with, is these denials, or you're getting the prior authorization, but then after the service is already provided, there's some other change that is hurting providers by not getting reimbursed.
Thanks, Jeremy. Senator Felzkowski, can you talk a little bit about what health priorities y'all are looking for this fall? Is prior authorization reform one of them?
So there is prior auth. There's some legislation out there now around prior auth. Senator Cabal-Guevara is looking at insurance price transparency to coincide with what's already happening at the federal level. There's issues around low value care. Do we need all this testing done? It's always been done. You know, the excuse has always been, you know, you're going to have x-rays first, then you're going to move to this, then you're going to move to that. So there's a lot of low value care out there, and I know other states have looked at it. We're going to keep pushing on price transparency for hospitals, PBM reform, making WHEO mandatory. I just came back from a conference. I have a real good friend who's a legislator. He's actually an anesthesiologist in Texas, and he has done a lot around controlling the cost of healthcare. I sat with him, site neutrality payments. There's a lot of things the state can do, and we're just going to keep working towards that. And I agree with what Lisa and Mike have said. You know, as this one big beautiful bill, as all the provisions unfold, you know, we're going to have to stay on top of that and working with DHS to see what the ramifications are on that, to make sure that we're ahead of the game as a lot of these things come into play, and you know, when they're actually become enforceable. A lot is going to happen around that January 1, 2027. That's actually going to affect our next budget, but we need to be ready way before that to know what we're going to be up against.
Thank you, Senator. And thank you to all our panelists. We remarkably ended right at 1, which is a rare accomplishment for us. Just for folks to know, our next panel is going to be August 13th in Milwaukee with the Jones, Wisconsin CEO. So thank you again to all the panelists for participating. Thank you to all the attendees for coming, and have a great day.
Thank you.
Thank you.